Chinese medicine is a complete, comprehensive philosophy and a way to treat people. And this medicine is thousands of years old. And I think that what people need to take away from this is this medicine would not have survived this long if it wasn't as effective and amazingly beneficial for an individual. Why would it? Why would we still be using formulas for 2,000 years ago? And we do actually still use those classical formulas. So what people should understand is that this medicine is beyond any real comprehension of how Western medicine is, because it's not. You just can't compare the two. They're completely and totally different. Western medicine gives, like Margaret said, one shot for everyone. They want to make sure if they're dealing with antidepressants, they want to be able to give it to a vast amount of people. You're on Paxil, lots of different people on Paxil. We don't work like that. It's very, very rare that we are going to give 5 people suffering from depression all the same herbs. There might be similar herbs in there, but we're really making a unique formula for that specific person. If somebody is really, really suffering, it might be the most beneficial thing for them to be on an antidepressant. And then we can also help them so they're not on it forever. What we don't like to see is that we don't like to see people being told that they need to be on a specific pharmaceutical indefinitely, because that basically they do not trust their body, and they're saying that your body cannot get better. And that's not our way of thinking. The way we think is that if you give the body an environment in which it can heal, it will do so. It's similar to if you have a tear, especially after childbirth. If you have a tear and you get that tear stitched up, those stitches are not doing anything. All it's doing is creating the environment in which the tissue can go back together. And that's what Chinese medicine does. It's really getting to the root of the problem so the body can essentially start repairing itself. And Western medicine doesn't have a lot in terms of offering that kind of health benefit. Looking at a woman's cycle is kind of like a cheat sheet. It gives us such a vast information about what's going on with that specific woman. It makes it really nice for us as clinicians to see the progress that's being made. If there's any disruption in a menstrual cycle, you can see the progress very, very quickly. So say you are somebody, I had mentioned clots before, say you have a very heavy period with a lot of clots. Within a couple months, you should see that period not be as heavy and have much less clots. If we're dealing with somebody who has very, very dark, thick blood, we want to see that blood become very bright red and healthy. So I mean, having a period, it's fantastic because we can see, the actual changes that are taking place. So that's, that gives women a lot of, it gives them a marker of which to judge how they're doing.
So can we go down this path a little bit, because there's 2 elements of this that I have been hearing just a lot in the mom chatter that I think they would find interesting.
Yeah.
The first is coming off the pill.
Yep.
And not like being startled at, this is what my period is truly like.
Yeah.
Maybe something else we could talk about is like the range of normal, what people say is normal for periods, and you're saying like, well, really there's still an optimal.
Yeah, exactly. Optimal. Yes, we're always looking for optimal. We're always looking for optimal. So when women are getting off birth control, I'm not a fan of birth control at all. So I will say that. That's the one thing I think it's horrible for women. It constricts your blood vessels, which is just not good for anyone. Having your blood vessels constricted for many, 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 many years, you're decreasing flow to your uterus, you are disrupting the pituitary, hypothalamus, ovarian axis. So when you're coming back on, you stop taking the pill and all of a sudden you're like, well, why aren't things working? Well, why would they? You've just been disrupting this for many, 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 many years. Some women aren't affected, but it depends on how long you've been on it, how old are you when you're getting off of it. So all of these factors take into place, and at the end of the day, I think a lot of women are shocked that they're not getting their period back as fast as they could have, or they thought they were going to. So So what we want to see in a period is we want to see as close to 28 days as possible. We want to see a regular cycle. We want to see bleeding for about 5 days. We want that blood to be very bright red. We do not want to see, we don't want to see dark blood. We don't want to see black blood. We don't want to see very thick blood. We don't want to see clots. We want to have very, very minimal pain. If there's any cramping, it should be on a scale from 1 to 10, maybe a 1 or a 2 the first day. That would be considered, that's fine, but we certainly don't want anybody that has to pop Motrin or ibuprofen several times a day for a few days in a row. And we don't want to see any PMS signs. We don't want to see a lot of bloating before your period. We don't want to see a lot of irritability or weepiness. We want this should be a very smooth, shouldn't be a disease. It should just be a process of what's going on in the body. It shouldn't be a problem for anyone. So and so our goal is always to get a woman to her optimal menstrual cycle. And ovulation should be around 14 days. Like it needs to be in the center, because if you have ovulation too soon or ovulation too late, if you're having ovulation too soon, your follicles are not having the opportunity to mature. But if you're having it too late, then they're going to be too mature. So we also want to make sure that you're ovulating on the right days as well, and we want to make sure your cervical fluid is correct. If you're if you're supposed to be ovulating, but there's no cervical fluid, you're not going to be fertile because you don't have that nice fertile mucus there to help the sperm along. So we take a look at everything going on. About it. For example, if you say, hey, I have a friend, and after she had her baby, all of a sudden her periods are super heavy, and she's bleeding through everything. This to me is going to tell me that there's a chi deficiency. The chi is sinking and is not being lifted up. So when she has her period, everything's just falling out, and there's not a lot of energy, or what we call chi, to really to contain the blood. And this woman might have some vaginal prolapse, or she might have a uterine prolapse. And it doesn't have to be, it can be a severe problem, but it can just be mild. But still, what that's going to tell me is like, okay, well, we need to lift her chi. We need to make sure that, again, diet is going to be very, very important for a woman like this, because the way we make chi is also going to affect the way we make blood. Any symptom that you're having that you're not happy with is because there's a problem, and you shouldn't be living with it. It doesn't matter if the websites are telling you that it's normal. No, it's not normal. If it's making you unhappy in any way, it's not normal. And so I always feel like that's really what I want to hammer home is we can address that. There's a way to address that issue. And it does not matter how mild it is. It doesn't matter how severe it is. You're free to call us. You're free to set up a free 15-minute consult. I'm happy to talk to anyone. I'm there on Saturdays. If you want to schedule a 15-minute appointment with me, or you want to do a 15-minute phone conversation with me, I'm happy to talk to you over the phone, just so I have an idea of what's going on, and telling you, yes, this is actually an easy fix. It might just be, hey, you know what? Actually, don't come in for a first appointment. Why don't you just adjust some things in your diet and follow up with me and let me know how that goes for you. I mean, so I feel like sometimes there can be very, very easy solutions. And often you might need to come in and get herbs, get an acupuncture treatment, but I'm definitely willing to explain any of that to anyone.